Hello, everyone. My name is Tshibambe, Nathaniel or Tshimbombu. Um, I'm presenting on the factors hindering the progress of neurosurgical services in the Democratic Republic of the Congo. It's one of the countries located in Central Africa. It's also known as the DRC. Now, an important element that I would like everyone to remember from this presentation is that there is a public health crisis in the DRC, as far as neurosurgery is concerned. The DRC has 16 neurosurgeons for 95 million people, which translates to one neurosurgeon for every 5.9 million people. We can compare that to the ratio of one to roughly 65,000. So one person, well, one neurosurgeon to roughly 65,000 people in the US. But the unfortunate reality in the DRC is attributable to many factors, but most importantly, there is the mismanagement of resources. So, research research indicate that nearly 93% of the population in sub-Saharan Africa, and sub-Saharan Africa is, if you look at the map here in the introduction, the green part on the bottom, there's a blue part on the top. That's the Northern Africa, but the Sub-Saharan Africa is all the countries located in the south side of the desert of Sahara. So, a research indicates that nearly 93% of the population in sub-Saharan Africa have limited access to basic surgical care. So, access to specialty surgical services such as neurosurgery is extremely, challenging due to complex social demographic factors. And such deficiency is quite pronounced in the DRC. As I mentioned before, a country of 95 million people with only 16 neurosurgeons. So in this talk, I will present challenges affecting neurosurgery in the DRC and suggest framework to guide future advances. Now, the DRC is, the map that you see on the bottom here. The DRC is a former colony of Belgium, and is the second largest African country with a population number that's almost a third of the US population. And the DRC is very rich, especially in natural resources, with untapped minerals estimated to be worth just over $24 trillion. But besides its own local revenue, the country has access to a tremendous pool of humanitarian assistance mounting to billions of dollars every year. But the money that the DRC receives as humanitarian is mainly used for food, healthcare, and education. But despite access to such funding, there is significant mismanagement, mostly due to duplication of health projects. Those projects are funded, generating high management cost and imbalance in the distribution of resources. So, project receiving funding in healthcare primarily focus on infectious disease, women, and children's care. So, what's the result of it? Well, the result of it is what we have here in this table. The tables are showing the number of neurosurgeons that we have, and they are distributed in the different regions in the country. So the surgical capacity building is disproportionately underfunded. As a result, neurosurgery care in the DRC lacks proper infrastructure, equipment, personnel to deliver the desired level of care. So, how can we fix this problem? Or, what are the avenues that can be taken, of course, to resolve this current crisis? Um, well, so there is what a lot of folks have worked on over the years that can be used to actually help or improve the situation in the DRC. There is the public approach versus the private approach. The public approach requires the government to provide enough resources and facilitate twinning with an institution overseas that has a track record of helping under-resourced countries develop and establish neurosurgical program with a tentative timeline in place to later become self-sustainable. because that's the key element, is helping those countries so that later on they can become self-sustainable. Or we could use the private, area where a private entity can work around the public system and use personal funding and resources to build an advanced neurosurgical hospital to treat patients and train personnel to increase the number of neurosurgeons to meet, the demand on the ground. So, but the thing is, whether we adopt a public approach or a private approach or both, there is a need also to incorporate what I called here the 4S of progress in global health to ensure proper health, proper healthcare delivery. And these are the system. A good healthcare system establishes a framework, of course, that ensures a clear vision and ultimately lead to a sustainability, right? So with a good healthcare system, it's easy to receive funding, and the funding will be used to purchase, a space, a building, or expand the already existing space, that in the country. And the funding can also be used to hire staff. And talking about staff, we're not only referring to surgical or even the non-surgical staff. Hiring them as well is important for a better functioning of the of a system. And then by staff, the staff include the imaging and other equipments that are also very necessary and currently lacking in most of the areas in the DRC. So to conclude, I would say that an appropriate approach, depending on the local setting, which is, of course, inclusive of the four elements that I just mentioned, the system, a space, staff, and the staff, is important to establishing a foundation, of a sustainable local neurosurgical program in the DRC and similar settings around the world. So thank you so much.
Oh my goodness, thank you so much for sharing that incredibly enlightening presentation about
Thank you.
neurosurgery in the Democratic Republic of Congo, which is a country that probably a lot of our American research don't know much about, especially around surgery and in ensuring optimal health outcomes for patients. So it was very enlightening. If anyone has any questions for this
Definitely, I,
presentation,
I should put my email somewhere here, and I'm
if you
still
go
trying.
if you go to the discussion tab underneath where it says people, you can put your URL as well as your email there. Folks
Um,
also, if they enter questions into the chat, we can make sure they reach you.
Definitely. Thank you so much. I think I think if you stop sharing, I should be able to see it. I
Oh,
think so.
let me stop sharing. Yes,
Yeah.
yes. If you
Let's
see it
see.
over here onto the right side, there's like a little arrow button and it says people and then discussion. And
Uh,
there is a little place for questions.
I'm not seeing it.
Oh, that's
I'm
okay.
so bad with technology. I'm sorry.
That's okay. No, no, that's fine. That's fine. So what we'll do is this. If anyone
Yeah.
has any questions, just be sure to put them in the chat.
Yes.
I'll trigger the chat now. So um,
Thank you so much. Thank you so much.
and we will make sure that they reach you and thank you again for this wonderful presentation. Some folks have written that they've really enjoyed what you shared today. And of course, folks will be able to see this presentation here on this platform. And then we'll also have it on HPHR Journal. So thanks very much. And
Thank you
we're going to
so
go to
much,
the next
Dr.
booth,
LaCrance. I
but
appreciate it. Thank
yes,
you.
take care. Take
And you
care.
too.
And you can stay here and see if any questions pop up if you'd like.
Definitely.
Thanks.
Oh, goodness gracious.